Hey everyone, and welcome to RUBIN'S Mind Lab, where we break down the latest research into what it really means. Ever wonder why it feels like everyone's trying to start fresh at the beginning of January? Well, this new study dives deep into why the new year might be a super powerful time for making real changes in our lives, especially when it comes to our health. Research shows that how we take care of our bodies, like what we eat, how much we move, and if we smoke or drink too much can seriously impact our health and how long we live. Millions of us make New Year's resolutions every year, and a huge chunk of those are about being healthier. This presents a really cool opportunity for scientists to study how people try to change their habits. This paper is a review, meaning the researchers looked at a bunch of other studies that already exist to see what we know about New Year's resolutions and health. They wanted to figure out if this time of year really helps people, what kinds of changes people try to make, and where we need more research. So, what is the big idea behind all this New Year's motivation? Scientists call it the fresh start effect. It is like when a new beginning, like a birthday or, yes, the new year, makes us feel like we can leave our past mistakes behind and become a totally new, improved person. Imagine it as a psychological reset button. This feeling can make us more motivated to tackle those tough goals. People often associate negative past behaviors with an old self, and this new beginning allows them to feel a stronger sense of self-control and a more positive outlook for the future. This idea of a fresh start is pretty powerful. It suggests that the calendar itself can be a trigger for change. Now, you might be thinking, but everyone knows New Year's resolutions fail. We've all heard of Quitter's Day, supposed to be around the 19th of January. But this research challenges that common idea. The studies they looked at actually show that many people do stick with their New Year's resolutions for a good amount of time. Some studies reported that over half of people were still keeping their resolutions a whole year later. That's pretty surprising, right? The researchers looked at 25 different studies to get a big picture of what is going on. They searched big databases like SciSinfo, PubMed, and Web of Science, looking for studies about New Year's resolutions or changes in health motivation and behavior around the new year. They wanted to see how many studies existed, what methods they used, what health behaviors were studied. And, most importantly, what the research suggests about whether these resolutions actually lead to change, and if interventions timed around the new year are more effective. The studies they found covered three main areas. First, did the new year actually make people more motivated and start making health changes? Second, could people keep up with their New Year's resolutions over time? And third, did starting health changes around the new year actually lead to better health results? Let's dive into what they found. The evidence was strongest that the new year does boost motivation and get people started on health behavior changes. Think about it. Have you ever noticed more people at the gym in January or people searching online for healthy recipes? One study looked at Google searches for terms like diet and popular weight loss programs and found a huge spike in January, which then slowly decreased throughout the year. Another looked at gym attendance and saw an increase right after the new year. Even sales of things like nicotine replacement therapies went up around January, suggesting people were trying to quit smoking more then. These are all signs that the new year really does spark an initial interest in change. This is great because even if people don't stick to their resolution for a whole year, that initial boost in motivation can still be a stepping stone. It opens them up to health programs and messages that they might ignore at other times of the year. Now, what about actually sticking to those resolutions? This is where things get a bit more mixed. About 13 of the studies the researchers reviewed looked at how well people maintained their resolutions over time. Some studies focused on specific health goals like quitting smoking or losing weight, while others looked at any kind of New Year's resolution. For specific health goals, the success rates were often modest. For example, in studies about quitting smoking, the number of people who stayed quit a year later was around 25% or less. For weight loss, it was also quite challenging. However, when studies looked at any New Year's resolution, not just health-specific ones, the reported success rates tended to be higher. This might be because people use broader measures of success when they're not tracking just one specific health behavior. It could also be that people are more likely to report success if they had a positive experience with their resolution, even if it wasn't a complete lifestyle overhaul. What is interesting is that some studies found that things like having an approach-oriented goal, meaning focusing on what you want to achieve rather than what you want to avoid, and having higher self-belief or self-efficacy, were linked to better success. Also, intrinsic motivation, meaning doing something because you genuinely enjoy it or find it rewarding, seem to be key for keeping resolutions going. The last piece of the puzzle is whether we can use the new year to make health interventions even better. Only 4 studies really tackled this head-on. Some looked at people who naturally started health programs around January and found they sometimes had better outcomes, like losing more weight or completing a fitness challenge. For example, one study found that people who started the diabetes prevention program in January lost more weight and attended more sessions than those who started at other times. It seemed like their greater attendance was part of why they did better. But one experiment tried framing medication reminders around the new year, and it didn't actually improve how many people took their medicine. This suggests that simply mentioning the new year might not be enough. The effect might depend on how well we can tap into those genuine fresh start feelings. So, what does all this mean? The biggest takeaway is that the new year truly is a powerful moment for many people when it comes to wanting to improve their health. It reliably boosts motivation and gets people to take that first step. While not everyone keeps their resolutions all year, a good number of people do report some level of success. And the idea that all resolutions fail might be an exaggeration. The new year might also be a really useful time to roll out health programs, because people are already primed to make changes. What is missing though? The researchers pointed out a few key areas. First, we need more experimental studies. The current research is mostly observational, meaning it sees a pattern but can't definitively say the new year caused it. We need studies that actively try to create a fresh start experience to see if it really leads to lasting change. Second, we don't fully understand why the fresh start effect works. Is it just the calendar, or are there deeper psychological reasons? Future research should explore these underlying mechanisms, like how we view our past versus future selves. Third, the research is heavily focused on us populations and mostly on smoking cessation and weight loss. We need to study more diverse groups and other important health behaviors like managing alcohol intake, getting enough sleep, or dealing with chronic conditions to see if the New Year's effect applies more broadly. And finally, we need to figure out how to best use this New Year's momentum. How can we design interventions that truly leverage this natural boost in motivation to ensure it leads to lasting positive health changes? Overall, this review makes a strong case that the New Year isn't just a date on the calendar. It is a unique psychological moment for people. While we're still uncovering the full picture, it offers a tangible, if somewhat predictable, opportunity to tap into people's desire for self-improvement. It encourages us to rethink the Quitter's Day narrative and see the new year as a genuine chance for positive change, both for individuals and for public health initiatives. What do you think? Has the New Year's fresh start effect worked for you? Let me know in the comments below. And if you found this breakdown helpful, give this video a like and subscribe to Rubin's Mind Lab for more dives into the fascinating world of psychology and how it impacts our lives. Thanks for watching, and I'll see you in the next one.